Welcome back to New Day Cleveland. We all know winter can take a toll on your hands, and here to talk about common problems and injuries is Dr. Nathan Monaco, and hand surgeon.
That's correct, David.
He shook my hand, and his hand, it all worked properly. So you know how to make it work, right?
Something like that, yes.
So what do you see in the winter? Is winter different than summer when it comes to hand injuries?
The winter is a different time, certainly because of the snow and ice. Puts people at risk for falling.
Oh yeah, and how about just like shoveling and things like that people do?
Certainly, overuse syndromes also happen in the winter time with the snow.
Hey, so what could you recommend to people? Like if you talk about people are going to fall down anyway, is there a good way to fall down so they don't have to go see Dr. Monaco?
Well, I think prevention is very important, and so you have to anticipate when you're going to take even a trip out to the mailbox. So any effort that you can do to clear the walkway of the snow and the ice is very important in order to prevent these falling type of injuries.
I'm also thinking tuck and roll, right? Get your hands out of the way so you don't bust your hands up.
Yeah, that's a good point. Unfortunately, it's very natural to place your hands out when you do fall, and this is in an effort to protect your hand, your face, and your neck region. And unfortunately, the result of that is the force usually goes through the hand and the wrist area, and so you can end up with an injury that sets you back a few weeks.
I hear about a lot of people that have an injury when they fall. It goes up into their wrist, like that navicular area there. Is that something that you also deal with?
We also deal with these areas. One of the misconceptions is that if you cannot move your hand, you have a fracture.
Bad.
Correct.
That's bad when you can't.
That's not very good. But it could be something as simple as a tendon or muscle injury. And conversely, if you still can move your hand, you also can have a fracture of one of the bones. And so that's why it's important to have your hand or wrist area examined when you do have a fall and an injury.
I heard of somebody, they were out cleaning their car. It was winter, it was cold, but they're out cleaning their car and their finger bent funny and they got something called a trigger finger.
Really?
Yeah, so what is that?
So a trigger finger has to do with swelling. It's sort of a brother or sister to carpal tunnel syndrome. And this involves clicking, locking, pain, catching at the base of the hand. It's oftentimes an overuse type of injury.
You bring up carpal tunnel syndrome, and you hear people almost self-diagnose themselves with carpal tunnel syndrome. What is it really, and how do you know you might be having that problem?
Well, carpal tunnel syndrome has to do with swelling around one of the nerves at the level of your wrist. Symptoms of carpal tunnel syndrome include pain, numbness, tingling in your thumb and radial 3 digits.
Okay, so if you have that kind of problem, they come see you and you can tell them if that's really what they have, and you can help them with that. How about emergencies? You fall down and you don't know for sure what's wrong with your hand. Do they go to Crystal Clinic, or what should they do?
We have a quick care center in many of our locations. That would be a very important first step if you do experience an injury, and they can appropriately refer you to a specialist that will be able to help diagnose the problem.
What other kind of things show up in your hands, like as you get older? Do things change in your hands as you get older and might need some attention or examination, maybe not necessarily surgery?
Absolutely. Arthritic conditions can also very commonly affect the base of the thumb region, and we can treat this with anything from a brace to an injection type of treatment. Okay,
so if you break a finger, does it involve surgery sometimes, or just a splint, or how do you fix that?
Because the injury patterns vary, oftentimes we have to take a look at the injury pattern, examine the patient, and then come up with a plan together, which would include anything from a brace, and certainly at times we also need to consider surgery as well.
I really like this too. When I was talking to the doctor, I moved my hands once in a while, and he'd follow my hand around. Like, he's not going to let my hand get out of sight. He's going to see, anything wrong here? We're looking good?
Looks pretty good to me.
All right, thank goodness. Thank you very much, Doctor.
Thanks for having us on.
Yes, sir. Handshake. Natalie?